When I was on an ER rotation during med school, we got a call about a 23-year-old woman who was shot in the head, and who was already completely gone, but was reportedly 5 months pregnant. So they were doing CPR until they got her to the hospital to see if the baby was viable. They got her to the ER and did an ultrasound, and it turned out the baby was full term. They did a C-section in like under a minute and got the baby out. I don't think it's so incredibly uncommon, but it was pretty surreal to see a baby delivered from a dead person with their brain exposed, and she was pretty close to the same age I was at the time. ER nurse here was doing CPR on a lady whose heart had stopped. They initially rolled her into the room unconscious and not breathing. This lady is pretty much dead. However, in the middle of doing chest compressions, her hands reach up and grasp my wrists and then fall back to hanging off the table. We never got her back. When I was an EMT, I had a very similar experience with a young man who was crushed by a falling tree. Such a gut-wrenching day. The young man was due to marry the daughter of the sawyer, who felled the tree a couple weeks after the incident. To make matters worse, everyone in the ER that day knew the internal bleeding could have been stopped, and the young man saved, if the surgeon wasn't a pompous prick who refused to come in that day. The look on everyone's faces when he reached out and held on to me 1.5 hours into treatment, I was bagging the patient, was utter relief. Monitors were checked and he was still flatlined. I hate that surgeon to this day for deciding that kid's fate, as we all squeezed bags of fluid and blood into him, and exhausted ourselves believing he would make it. His life was worth more than what that doctor decided over the phone. I miss helping people, but I never miss being helpless and losing these battles. Whenever you admit a patient, you have to inquire about their DNR status in case of a code being called. I had one elderly patient, late 80s, who was severely demented and chronically ill, in and out of the hospital every month, barely holding on to life, basically a horrible, miserable quality of life. I asked for the patient's family. I think it was a granddaughter who had medical power of attorney, but I'm not sure, it was a while ago, about their DNR status. You don't want to put someone through a brutal resuscitation that may not even work if it isn't something that they would want if they wanted to die naturally. She flat out stated that, "Oh, we want everything done for him because we really need his check." I didn't understand at first, but apparently the family was living off of his social security and could not have cared less about his pain and suffering or his wishes. I'm pretty sure it was the creepiest thing I've seen. These people were supposed to be his loved ones taking care of him, and they were using him like an inhuman object. Former critical care and emergency department nurse here. 2 stories, both of which occurred at a large Houston hospital in the mid-1980s. Every time I tell them, I get medical types telling me I am lying. I'm not. Both are from the emergency department. Story 1, EMS brings in a young man, about 25. He is in a decerebrate posture, stiff, hands in partial fists, turned out, indicating deep brain damage, and being manually bagged. As he came in the door, he was not intubated. According to EMS, his girlfriend had found him in bed with another woman, either drunk or deeply asleep. She carried a .25 caliber pistol with her, and the report was that she placed the weapon directly against the patient's skull and pumped 10 rounds into his brain from various angles. The rounds were powerful enough to enter the skull and bounce around, but not to exit. All higher brain function was destroyed, but autonomic functions remained. We intubated him, inserted a breathing tube, and placed him on one of the old Bourne's Bear ventilators, very primitive by today's standards. This caused the patient to buck, to fight against the ventilator with deep coughs. When he did so, the pressure within his head increased and little fountains of brain matter would be expelled from the 10 holes in his skull, several feet. One got me in the face. I was pretty well protected by clinical distance at the time, but I must admit, this really got to me. There was really nothing that could be done for him, other than supportive care, and he died a few weeks later of a massive infection. Story 2, another young man had agreed to be mummified in a rather extreme sexual practice. Essentially, he was placed in a full-body plaster cast covering even his face and was given breathing tubes through the cast. Other than that, he was fully encased in the cast with the exception of his toes, genital and anal area. My understanding was that this extreme degree of helplessness was considered erotic. The normal practice was to use a cattle prod or some similar device rectally to force ejaculation, but in this case, either through ignorance or malice, he was directly connected to 220 volts with one probe in his rectum and another probe on his foot. He had third-degree burns over his entire genital and perianal area, deep burns on his foot and from the smell, severe burns elsewhere. Blood, feces and serous fluid was leaking from what had once been his rectum. We tried removing the cast to see if any degree of resuscitation was possible, but by the time it was even partially off, it was clear he was quite dead. All of us just stood there with our mouths open, utterly unable to say anything. The police came and they too were mute. I volunteered to remove the entire cast and render some level of post-mortem care. I found deep lacerations over much of his body, deep bruising and quite a few other burns. We sent the body to the medical examiner and I spent the rest of the shift trembling and vomiting. Nothing I can say can possibly describe the year I worked in psychiatric intensive care. Creepy isn't the thing that comes to mind when I think back on it. More heartbreaking and horrifying. But creepiness was a part of it. Especially evening and night shifts, naturally. There is always something disturbing about watching someone while they hallucinate. You can tell it is 100% real to them, and something about that makes you believe it, on some level. A lot of stories end with, and of course, I had to look over my shoulder to make sure. You see the emotions it brings out. Here's a couple stories. There was a woman that came in and sat down across the table from me for her admission interview. She had bandages all over her arms and scotch tape over her mouth and ears. She looked very uncomfortable and wouldn't really sit still. When the nurse would ask her a question, she would peel the corner of the tape back and answer, then stick the tape back on really fast. We eventually found out that she saw and felt bugs crawling all over her, and they were trying to get inside her body. The tape was to keep the bugs out. The bandages were because some bugs got in and she had to dig them out. She couldn't sit still because she felt the bugs all over her even while we sat and talked. The worst part was, she had some idea that it was her mind playing tricks on her. Can you imagine going through your life, feeling like someone is continuously dumping buckets of cockroaches on your head, feeling like they're all over you and getting inside of you to the point that you're digging chunks out of your flesh in a panic, all while knowing intellectually that none of it is real? Another story, a girl spent my entire 8-hour shift fist fighting the same ghost. She would throw a few punches, and obviously landed knockout blows, so she'd bend over and twist her hand around like she was wrapping some long hair around her wrist. She'd drag her opponent down the hallway, give a few good kicks, then set up for a curb stomp. Starts off kind of funny, then gets a little disturbing when you think about the graphic things going on in her mind, then just sad after you watch this replay for hours on end. A friend used to share stories of when she was newly a nurse. She was checking out a patient, following protocol. This guy had been seen multiple times, and given an antibiotic for a lung infection. Again, this guy had been seen by a nurse and doctor and she was to do the last follow-up before releasing him. What is this? A shirt. I keep them in my hole. Dude had an abscess so big that he stuffed a t-shirt in it and forgot about it. At the time it had gotten so large that he now stuffed 3 shirts in. Neglected to tell the doctor or get it checked out. By the time the last pus and blood-soaked one was pulled out, the smell was so bad it cleared the room. I'm not a doctor, but I am in the healthcare field as a dental hygienist. The creepiest and most confusing thing I've seen is as follows. We had a new patient come in for a cleaning. He was around 4 years old, and mom said he had never been to the dentist before. Not uncommon for what I see on a daily basis, so at first I didn't think anything of it. I did his cleaning, and then went to take his routine x-rays. This is where things got weird. After looking at the x-rays, I could see that the child had already a large amount of dental work done. He had around 7 composite, tooth color, fillings. When I sat back down at my chair, I asked the parents again if he had ever been to the dentist. They were both adamant that he hadn't, and also said there was no way a relative could have taken the without them knowing. What the hell? How did this happen? Who took him? Where were the parents? Had they possibly been in jail for a long time and not known he was taken to the dentist by someone else and had work performed? What if this wasn't really their child, and actually some kid they kidnapped? His insurance had no record of him having previous dental work, so that was a dead end too. I think about it often, but know that ultimately, I'll never get an answer. I work as a psychotherapist in a hospital system. My definition of creepy is probably quite a bit different from other medical professionals. The one that got to me the most was a patient who came to us after attempting suicide by sawing both his arms off at the forearm with a table saw. His arms were reattached, fairly successfully too, with only limited impairments in mobility. All I could think was how bad it would have to be to live in his head that sawing his arms off seemed better than that. I'm not a doctor, but I'm a nurse. I work with geriatric patients and there was this incident about 3 years ago. Before I explain, let me say that I don't believe in ghosts. Anyway, This one time I was working the night shift and I was super sleepy, so I decided to skip lunch because I wasn't hungry and go to my car and sleep for 30 minutes. I got inside my car, covered myself with my sweater, set the timer on my phone and immediately knocked out. I'm dreaming, but in my dream I'm still awake just sitting there. Someone taps on my car window and I see that it's one of my patients. We'll call her D. Surprised, I ask D what the hell she's doing outside and she tells me she is looking for her daughter. I tell her to go back inside and that we will call her daughter in the morning. My patient becomes angry and starts banging on my car window. I kinda freak out and try to reach for the door handle to get out and calm her down, but I quickly realize I can't move. Let me add that I frequently experience sleep paralysis, so even though I am asleep, I realize what is happening. I fight it and try squirming my body in an attempt to wake myself up. I finally manage to wake up and my heart is racing and my forehead is a bit sweaty. I sit there for about a minute, realize it was all a dream and roll the window down to cool myself off. My break is over and I clock back in and see that my supervisor and 2 other nurses are huddled in front of the room. I am still by the station clocking when they see me and call me over. I walk over thinking maybe something was wrong with the ventilator or the patient fell. But my supervisor tells me D died while I was on my lunch break. Since most of our patients are DNR, I was not paged. It took a couple of seconds for the message to register, and I freaked out internally. I got goosebumps but didn't mention anything to my supervisor about the dream. I don't believe in ghosts or anything like that and I mostly likely had the dream because she was the last patient I interacted with before my break, so she was still on my mind and I was mentally going over my patient's charts in my head. Motorcycle driver, accident, 3rd-degree burns, arrived death. Had to transfer him from ambulance gurney to ER bed. As we were moving him with a transfer sheet, the liquefied cooked subcutaneous fat caused the charred skin on his back to separate. His body slipped onto the floor, despite several of us trying to catch him. As a tech in psych years ago, there was a 7-year-old kid sent to the floor because the mom didn't know what to do with him. Sadly common thing to happen, even if the kids don't have psychological issues. Anyway, the mom was shaking and crying, and they had to take the kid into another room. She was genuinely afraid of her own son. She had suspected something was wrong when she kept finding mutilated animals in the backyard, but never heard or saw coyotes or anything around. The neighbor's smaller pets started disappearing. The boy had an obsession with knives, hiding them around the house. Denying anything when the mom confronted him. Then when the two started getting into arguments, he would get really violent and hit her, push her down and kick her, threaten to kill her. On multiple occasions she woke up in the middle of the night with him standing beside her bed, staring her in the face. She put extra locks on her bedroom door to feel safe while he slept. The last straw was when she lifted up his mattress and found around 50 knives of all shapes and sizes under there. So she brought him to us. I remember talking to him, treating him like he was just any other kid that came through. He seemed remarkably normal, until you spoke directly to him. He had this way of looking right through you, or maybe like he didn't see you at all while you were speaking. He would respond like a robot, like he was just saying words because that's what we wanted to hear. And B would always put on this creepy, dead-looking smile. Like all mouth and no eye involvement in the smile. Especially when he would get away with something, like taking another kid's markers and they couldn't figure it out. Still gives me chills laying here thinking about him. I had to get up and close my bedroom door. I believe I met a 7-year-old psychopath. Paramedic here. We got a call to go out to a scene for an elderly woman with chest pains. Arrive at the house, front door is open. We knock, hear the old woman calling out from the back, "I'm in the back room," in a very monotone and calm voice. My partner and I go to the back of the house looking for this woman, and that's when we smelled it. Nothing prepares you for the smell of rotting corpse. I've smelled it a dozen times, and it never gets any less disturbing. We radio for police and ALS backup as we move through the house. We open the door to the master bedroom, and there is our patient. She is approximately 80, and she is staring at the master bathroom with these cold, dead eyes. She never once looked at us as we approached her and began talking to her. I got to the bedside and got in front of her gaze, and she just looked right through me. I turned around to see what she could possibly be looking at, and there was the source of my smell. A man, about the same age as my patient, is on the floor with very little left of his head still attached to his body. A shotgun lay on the floor next to him, and most of his head was strewn about the walls and bathroom counter. We loaded the woman up in the ambulance, and our police backup pulled up. I don't think that woman blinked once the entire time she was in our care. Totally messed me up.